Welcome to my Lecto. Today we are going to discuss the general overflow of the blood in the heart, cardiac cycle, and the pressure and the volume of the ventricle in diastolic state and the systolic state. So let's start. First of all, we will discuss the general overview, or you can say general flow of the blood in the heart. So as we know that the heart consists of here you can see the right atrium and here is the left atrium. This is the right ventricle and this is the left ventricle. So these are basically the four ventricles. So as we know that the blood flow through the inferior vena cava and through the superior vena cava into the right atrium. So this is the case. Now from the right atrium, blood flow through the tricuspid valve. Here is, you can see, this valve is basically the tricuspid valve. So now the blood flow through the tricuspid valve into the right ventricle. And from the right ventricle, blood flow into the pulmonary trunk, or you can say pulmonary artery. So through another valve, this is the semilunar valve. This is the semilunar valve. Through the semilunar valve, the blood flow through the right ventricle towards the pulmonary trunk, and through the pulmonary trunk you will see the blood goes towards the lungs. So as we see that in the right side of the heart we see the deoxygenated blood. So from the pulmonary trunk, the deoxygenated blood goes toward the lungs, and where the blood get oxygenated, and after oxygenation the blood goes back toward the heart through the pulmonary vein, and that pulmonary vein contain the oxygenated blood. So here are basically the pulmonary vein, and these pulmonary veins opens into the left atrium. So here from the left atrium you will see another valve. This is the bicuspid valve, or you can say mitral valve, another name of the bicuspid valve. So blood from the bicuspid move into the left ventricle. So now this is the case. From the left ventricle, the blood move into the aorta, and before it move into the aorta, there is an other valve. This is also the semilunar valve. So here are basically the two semilunar valve, and through the aorta you will see that they goes upward through the different carotid arteries, and after that you will see the descending aorta that supply blood to the lower extremities, or you can say abdomen. So this is the basic general overview or general blood flow in the heart. So if we see that two terminologies are very much important. So if we focus on the two terminologies like diastole and systole, these two terminologies are very much important. Diastole is the relaxation phase of the cardiac muscles. Systole is the contraction phase of the cardiac muscles. So if we see that we divide the diastole into two, atria and ventricle. Okay, this is good. And we also divide the systole into the atria and ventricle. If the atria are in relaxed state, then we call it diastole. When the ventricle are in relaxed state, then we call it ventricular diastole. So this is the case. Now when the atria are in contract state, then we call it atrial systole, and when the ventricle are in contract state, then we call it ventricular systole. So this is basically the difference. Now if we see the cardiac cycle, which is approximately 0.8 second. So if we see that the starting point, here you can see this is the just like the target, and if we see that this is the 0.1 starting point, 0.2 second, 0.3 0.3 second, 0.4 second, 0.5 second, 0.6 second, 0.7 second, 0.8 second. So here is basically the whole one cardiac cycle. So this is the case. Now, if we talk about the atria, when atria in diastolic state and when the atria are in systolic state in the one cardiac cycle. So if we see that, if first of all we talk about the atria, so in the 0.1 state, here you can see at the 0.1 state you will see the atrial systole. You will see the atrial systole. So if you see, the inner circle is for the atria, the outer circle is for the ventricle. So if we see that from 0.1 second you will see the atrial systole. Atrial systole is just for the 0.1 second. Now if we see that after that the whole remaining will be the 0.7. So 0.7 is for the atrial. So here is the atrial diastole. In that situation you also see the atrial diastole, atrial diastole, atrial diastole, atrial diastole, atrial diastole, atrial diastole. So if you see that atrial systole is just for the 0.1 second, and after that you will see the atria remain in diastolic state for the 0.7 second. So this is the case. You have to remember that the atrial systole is just for the 0.1 second, okay? And you also see that the atrial diastole is just for the 0.7 second, and total will be the 0.8 second. So atria goes through these conditions in one cardiac cycle. So if we see that, if we talk about the ventricle, so here you can see that ventricular systole, ventricular systole, ventricular systole. So ventricular systole remain for the 0.3 second. This is the 0.1. One box is 0.1. One box 0.1, 0.1, 0.1. So total will be the 0.3. So if you see that the ventricular systole is for the 0.3 second. This is another situation. And if you see that here, when we talk about the ventricular diastole, so here is the ventricular diastole, ventricular diastole, ventricular diastole, ventricular diastole, and ventricular diastole. So it's mean what box? 1, 2, 3, 4, 5. So it's means 0.5 second is for the ventricular diastole. So here if you see that this is the ventricular diastole that remain for the 0.5 second. So 0.3, 0.5, the total will be the 0.8 second. So this is condition for the atria, this is condition for the ventricle. So this is the basic cardiac cycle. So if you see that if we compare the atria and the ventricle, then if you will see that if I write it with the black color, so it can be easily for in understanding. So when you will see the atrial systole, then at that time you will see the ventricular diastole. So this is the case. When you see the atrial diastole in 3 box, at the same time you will see the ventricular systole. This is another situation. So if you see that this situation, here is the situation. In this case, you will see the atrial diastole and ventricular systole. This is the case. If you see in that situation, half cycle, this is the case. This is the half cycle. In that case, you will see the atrial diastole and also the ventricular diastole. So in that situation, both the atria and ventricle are in diastolic state. And last, this portion, this one is for the in which the atria in systole and ventricular in diastole. So this is the basic cardiac cycle in which you will see the different situation of the atrial systole and the ventricular systole, atrial diastole and the ventricular diastole. So this is the case. If you see my previous lecture, then we discuss important things. In between the systolic state and the diastolic state, we see two different things. So if we see, like, here is the situation. Let's suppose if we see the systolic state. Here is the systolic state. Okay. Or you can say this is the diastolic state. So in between the systolic and the diastolic state, you see another situation. So if you see, before the diastolic state, you will see the isovolemic relaxation. Isovolemic relaxation, and you see that if there is another thing, and if you see here, so here is another systole, and if you see before this systole, you see the isovolemic contraction. So keep remember, this is the systole, and this is also the systole, and this is the diastole. So if you see first one, you will see the systole, then you will see the isovolemic relaxation, then you will see the diastole, then you will see the isovolemic contraction, and then you will see the again systole. That's repeat again and again. So this is actually the whole process that going on in the heart. So if we talk about the pumping of the atria and the ventricle, so if we see that, as we know that the blood comes into the right atria through the superior vena cava and through the inferior vena cava, and if I say that the blood accumulate in them, okay, blood accumulate in the right atrium. So it's mean the right atrium are in diastolic state. Blood fill in the chamber only when the chamber are in relaxed state. So when does right atria in diastolic state? So if we see that the talking about the atria, so here is the cycle, that in which situation you will see the atria are in diastolic state. So this is the case. And if we see in what situation the right ventricle also in diastolic state, so half cardiac cycle, in which here is the half cycle. Here is the half cycle in which you will see both the atria and the ventricle are in relaxed state. So it's mean that the blood entered through the superior and inferior vena cava and accumulate in them, and without any hindrance the blood also continuously flow into the right ventricle. So this is the case, because if this is the state which is 0.4 second, all the chambers of the heart in relaxed state, diastolic state. So that's why blood continuously enter into the atria and continuously you see that the enter into the ventricle. So approximately you will see that the 80%, I am talking about 80% of the blood continuously enter into the atria and you will see move into the ventricle. So this is the case. And in that situation, what will happen? After this cycle, half cycle, you see other situation in which you will see the atrial systole, in which now the atria contract. And again, you will see the ventricle are in again diastolic state. So it's mean this situation, I am talking about these 2 points in which when the atria contract, then the remaining 20% blood move through the atria into the ventricle, and in that situation ventricle are also in relaxed state. So it's mean that the remaining 20% blood that is present in the atria move into the ventricle when the atria contract. So this is we discuss up till here from the 0.4 to 0.8 second, and after we discuss the 0.1 second. So this is the case. Now if we say that the atria stop contracting, and you say that the atria is dysfunctional, So then what will happen? You will see that the effectivity of the heart will not be as such affected by the atrial dysfunctional. When the atria stop functioning, then you will see the heart pump properly, approximately. There is a little changes, but you will see the heart function properly. But when the atria are in, let's suppose, dysfunctional, and someone doing exercise, then what will happen? Then the patient goes towards the cardiac failure, and you will see the shortness of breath in that situation. So this is the case. Normally person will survive, or normally when the atria are dysfunctional, but when he or she do some exercise, then it's create problem for him or her. So this is the case. Now if we talk about the ventricle, so here you see that after that you will see here is the situation, this cycle from the 0.1, from the 0.1, 0.2, 0.3, this cycle from this one. If we see here, then after that the ventricle contract, and in that situation the atria relax. Atrial diastole, here is the ventricular systole. When the ventricle contract, then the blood goes into the pulmonary trunk, and same here, this same process can happen here in that situation on the left side. Same process will happen in the left side. So this is the case. Now if we talk about the pressure and the volume changes in the left ventricle, we will discuss specifically left ventricle. And if you see my previous lecture, in which we discussed the isovolumic contraction, relaxations, and different things like systole and diastole, so you can easily understand this lecture. Otherwise this lecture will be difficult for you in understanding. And this I am talking about the left ventricle. So here you see there are two graphs, and in that situation we see the, first of all, this graph is for the volume changes, and this graph is for the pressure changes. And keep remember, we talk about the left ventricle and left ventricle. So this is the case. Now as we see that isovolumic relaxation, this process, you just keep remember this process. Now here you see that the first box is for the isovolumic contraction on the upside and on the downside. This is the case. Now after that you will see that this portion is for the systole, this portion, this one and this one. This is the case. Now if you see here, this is the isovolumic relaxation, upside and downside. This is the case. Okay. Now if we move forward, then you see the diastole, upside, this whole things and this whole process. This is the case. So this is the, you will also see the between the systole and the diastole, between the systole and the diastole you will see the isovolumic relaxation, between the diastole and the systole you will see the isovolumic contraction. So same here is the thing. And if you see here, then again you will see the starting of the, here is the case, you will see the starting of the isovolumic contraction. So this is the whole process that happening in the heart. So we are talking about the left ventricle. So in that situation you have to remember that the pressure, I am talking about pressure, is inversely proportional to the volume. What volume? Volume of the blood. I am talking about the volume of the blood. So this is the case. Pressure is inversely proportional to the volume of the blood. When the pressure increase in the left ventricle, then the volume that is present in the left ventricle decrease by the flowing into the aorta, or you can say by flowing into the pulmonary trunk. So this is the case. You just keep remember this trick, that pressure is inversely proportional to the volume of the blood. So you can easily understand these two graphs. So here, first of all, we will discuss the isovolemic contraction. In isovolemic contraction, the heart muscles or cardiac fibers start contracting. But in that situation, you will never see the change of the volume. So this is actually called the isovolemic contraction, in which the cardiac muscles start contracting, but the volume of the left ventricle will remain the same. So it's mean that what will happen? In that situation, you will see, first of all, we talk about the pressure. So you will see, here is the pressure 0 to 120. Maximum 0 is the minimum, 120 is the maximum. If we talk about the volume in milliliter, so 50, smallest volume that can present in the left ventricle, and highest will be the 130 or sometime 120 as well. So this is the case. If we see isovolemic contraction, the pressure in the left ventricle is 0 and the pressure start increasing. If I say that increase up to the 80 millimeter pressure increase in the left ventricle, but this is the isovolemic case. In that situation, you will see the volume in the isovolemic state will be the 130 millimeter. Maximum blood is present in the left ventricle. So this is the case. Pressure increase 180 up to 80 millimeter mercury, but in that situation the volume does not change, which is the 130. This is the maximum volume that can present in the left ventricle. Now if we see, when the if we talk about the next state is systole, in which the heart start contract. If you see here, then the pressure increase up to 120 millimeter mercury. So in that situation, you will see, if the pressure increase, then the volume of the blood in the ventricle will start decreasing by the release into the aorta. So in that situation, you will see the volume of the blood start decreasing. This is the case. Half, because up till you will see the 120 millimeter increase, and after that you will see the volume decrease, volume of the blood in the ventricle decrease. If you see that the pressure decrease, but it does not decrease up to 0, it decrease up to the 80 millimeter mercury. So it's mean that 80 millimeter is still present in them. So it means that the further decrease in the volume of the blood. So this is the case. So this is actually happens in the systole. Now you see that in the systole, you see the pressure of the ventricle is 80 millimeter mercury and the volume of the blood that is present in the left ventricle is 50 milliliter. So keep remember that someone says that all the blood present in the left ventricle move into the aorta. This is wrong. Some amount of the blood will remain in the left ventricle, which is actually called the end systolic state, which we have discussed. Now, if you see here that when in the talk about the IVR, this is the IVR, which is the isovolemic relaxation. In the isovolemic relaxation, you see the pressure decrease and what amount? 0 millimeter mercury. So in the isovolemic relaxation, the left ventricle goes toward the 0 millimeter mercury. Okay. If the pressure decrease, then you will see here, in that situation, in the isovolemic, same volume, the blood volume of the blood that is present. So here in that situation, what amount? 50 milliliter is actually present, will remain the same, and there is no changes in the volume that is present in the left ventricle. So this is the case. Now if you see here, the next state is the diastolic state. This is the diastolic state. Before we discuss the diastolic state, we divide the diastolic state into 3 cases. So if you see here, that first one is the rapid inflow. Second state is the diastasis, and third state is the you can say atrial systole. Atrial systole. So first of all, you will see in the first state of the diastole, which is the pressure will 0 millimeter mercury. Okay, this is the case. Now in that situation, the ventricle is in, the pressure is 0, so it means pressure is decreased, then the volume start increasing. So in that situation, first of all, you will see the rapid increase in the volume of the blood in the left ventricle. So this is actually called the rapid flow. This is actually called the rapid flow, in which the volume rapidly increase. So this is the case. Now, and next is the diastasis state, in which the pressure will remain the 0. So in that situation, again, what will happen? In the diastasis, the blood continuously move here and the volume increase. In that situation, pressure is 0, decrease, then the volume further increase in the diastasis state. So this is actually the longest state of the left ventricle. So in that situation, in the diastasis, that remain for a long time, and in that situation, the left ventricle continuously fill. And if we see that in that situation, you will see there is some increase in the increment in the pressure of the left ventricle. So still you see that in that situation, the volume increase, and you will see up till 130. So in that situation, you see last state, you will see, as we discussed, the 80% goes from the you see left atrium into the left ventricle in two situations, in the rapid flow and the diastasis. You will see the 80% blood flow from the left atrium into the left ventricle simultaneously. But when the left atria contract, then the remaining 20% goes from here and fill the left ventricle. So in that situation, the last is the 20% blood. In that situation, atrial systole. So in that, when the atria contract, then the remaining 20% blood flow here and fill the left ventricle. So this is the case, and this is all about the volume and the pressure changes. So here, if you see that the again, you will see the, here is the isovolumic contraction. So in isovolumic contraction, the volume will remain the 130, and if we talk about the pressure, then if you can see here that in the isovolumic contraction, you will see the pressure increase and up to the 80, like this one. So it means that this is the starting point and this is the ending point, and you will see the another cardiac cycle start from here. So this is the left ventricle pressure and the volume changes. So in this case, you see the different situation. First of all, we will discuss the isovolumic contraction, systole, isovolumic relaxation, diastole. So this is the case. You see here that another thing is important, which is you have to remember that in this systole, you see the volume decrease first. So this is actually the rapid decrease. This is the rapid decrease of the blood, and after that you will see the slow decrease in volume. So this is the case which we have discussed, that in the rapid decrease, or you can say rapid ejection, because in systole the blood goes into the aorta, and after that you will see the slow ejection, which are basically the two phases of the systole. So this is all about the different cardiac cycles, flow of the blood in the heart, and the volume and the pressure changes in the ventricle. If you have any question, then you may ask in the comment section. Thank you.